Welcome back to MZ1. Let's talk about PPE, personal protective equipment for the healthcare professional. All right, let's talk about some straightforward stuff. We want to be in PPE as much as possible. We know from the CDC guidelines that a professional can wear an N95 mask or surgical mask for up to 8 hours unless it gets soiled. This is part of the CDC guidelines on coronavirus.gov, all the standard stuff we should be following. So you get to somebody and they have an airway issue, or you need to suction them, or you need to use a BVM. Well, certainly at that point, you're going to do your level 3 PPE. You're going to be wearing gloves, you're going to be wearing an N95 mask, you're going to be wearing some type of facial coverage such as goggles, and you're going to be wearing a full gown. That makes perfect sense. Now, what about the patient who is lower risk? Well, if the patient's lower risk, meaning you're not going to be near their airway, then a surgical mask is appropriate according to CDC guidelines, especially if you're running low of N95 masks. So if you have somebody who has an ankle sprain, you can just wear a simple surgical mask. Now, I know not everybody carries some surgical masks. I know some healthcare professionals are low on N95s. I know some healthcare professionals are low on gowns. Some are low on plain surgical masks. Everybody's a little bit different. So you need to judge what your capacity is as you potentially surge and get more patients. But for now, patients with anything near their airway, including suctioning, you should be in full PPE. Again, including N95 masks with the goggles, face mask, gown, and gloves. The patient who does not have a respiratory issue, but you get called to see them, I'm being asked, should I wear PPE? The CDC guidelines don't specifically answer this question. Let me give you an example. You get called to see somebody with an ankle sprain. Do I need to be in full PPE? And this is a harder question to answer. And it's a harder question to answer because of a recent study that was just published from Singapore where they had 91 patients. And it was a Belgian study, and they found that some of these patients were pre-symptomatic or asymptomatic when EMS interacted with them, and they didn't get symptoms till about 2.5 days later. My general recommendation at this point is that you should be in at least level 2 PPE with any patient, no matter what their chief complaint is, no matter what signs or symptoms they have. So that would include an ankle sprain, etc. So if you have an overabundance of N95 masks, right, which most of us don't, then putting on an N95 mask for that routine ankle sprain with the gloves and the gown is okay. For most of us, this is going to be a plain surgical mask with goggles and with gloves. But that's my current recommendation for being around routine patients.